So now as you come into standing, the pelvis is really the focus of attention, second week of the month. And the pelvis, as I've also been saying in yoga, is such an interesting piece of equipment. It is what has to translate from movement from legs to spine and vice versa, and very different modes of communication, and everything gets kind of stuck here. As you stand on the front, you can feel your front hip parts. On the back, hip parts too. And these somewhat level, but without tucking the tail or poofing it back. And if the hip flexors are tight, that's the quadricep and the psoas, sit down a lot, we close up in this area, and then we come into this little tilted event. If you stand with your tush going back, try to take a deep breath in here. And notice how it's very easy, becomes a chest breath. So if you tuck the tail, and you see people stand like this, now try to take a deep breath here. Again, it doesn't really travel all the way down. So thinking about the pelvic floor, sitting, and it's sometimes described as a hammock. I teaching this with all girls, it's a little bit easier to understand, because I think as confusing as it be for women, for men in particular, it's like a who, what, where. So the pelvic floor is actually 3 layers of muscles. It is an integral part of our core strength. Your gut, your whole belly sits right down in the pelvis. And if there's laxity or tension, a lot of tension in the pelvic floor, it inhibits how we walk, it inhibits the movement of the spine. The tailbone is connected to the tongue via the fascial band. And when there's tightness in one area, we have tightness in another. So one way to sort of gauge to stand, just am I standing with my pelvis neutral? Your front hip points where they hit the front. And your pubic bone should be, and this is, where it gets a little graphic, should be on the same plane. If your hip points are sitting forward off the pubic bone, you can feel that down towards where your lower abdomen hits hard, then you are a forward tilter. But if your hip sits forward, then the opposite. Now, one way as you walk around, notice where is the movement in your hips? What seems stuck? Is the tendency to dip the pelvis forward so the low back is a little tighter? Or is it the other? How does the leg connection to the pelvis feel? And does the spine just float along effortlessly? For most of us, it does not. When we come now, let's come onto our backs. And we'll take gravity out of this whole scenario. We'll get another clue as we lay down.
And
yes. Oh,
this is Sally. Before we
yes,
totally get going, I just wanted to say that poem that you sent about the pelvis,
wasn't that cool?
Was hilarious.
I love that little poem, and it's actually written by a yoga teacher.
I like it.
Thank you.
Okay, that's it.
Oh, well, thank you, Sally.
I'm muted again.
So yes, the pelvis is such an integral part of our trunk, but also our legs, as it has to communicate above and below. So as you take your legs out long, I'm going to ask you first if your chin pulls back due to tightness in the back of the neck, just take your blanket and slide it under the head so that you are comfortable. And then notice the space below your back. Notice the space behind your thighs and legs. And as you arch the spine up, we'll exaggerate If we are very lifted in the back, then that tells a little bit about the hip flexors again. If you're laying very flat, now that tells us something about the hamstrings and the psoas also. So we're going to look at this entire complex today. Hey, Roberta, good to see you. So from here, let's bend up the knees. Keep your hands on your belly. And we begin to have a chat with the diaphragm, the main muscle of breathing. So as you breathe in, invite the belly to expand. And as you breathe out, the belly relaxes down towards the spine. So we do this every class. Today we're going to get a little bit more specific. The breathing diaphragm and the pelvic diaphragm ideally moves together. So on your in-breath, you feel the belly expand. Can you draw your awareness lower and feel your pelvis expanding, both sideways but also downward? So there is a little give in the pelvic floor. And as you exhale, there is a sense of contraction. Pelvis contracts back in and pelvic floor moves up. You're not doing anything muscularly. You're just letting the connective tissue, the visceral drag in the body facilitate this. If we are completely locked down in the pelvis and this doesn't happen, these muscles may be really tight. They are often if we have hip pain, low back pain, back pain, we lock down in the pelvis, which sets off a whole chain reaction of imbalance. So just let the breath begin to massage this awareness and release. When the pelvic floor gets all bound up, a couple of things can happen. Incontinence, one of them, and lack of strength here too, also really plays havoc with what if we suffer organ prolapse. Now, this is one of the best things to work with for those conditions, bringing balance. So while the breathing diaphragm contracts and releases, everything else is just along for the ride. But we can begin to make this a little bit more conscious. So let the in-breath be the same, belly expands, pelvic floor moves down with the diaphragm. Then as you exhale, draw the pelvic floor up, not in a harsh way, but a conscious contraction upward. So a gentle mula bandha on yoga. Inhale, relax everything. And exhale again. Draw the pelvic floor up. I'm going to have you separate it out because we can have tension and tightness in different areas. To get a visual of the area of the pelvic floor, put your hands up and just so you can see your hands in front of your face. I'm just going to create a little visual picture. Take the thumbs towards one another and your index fingers towards one another. So you create a little triangle. At the top of the triangle where your index finger meets, that's where the urethra is located. In the middle is the vagina, and at the bottom is the anal sphincter. And out to the sides where the thumb and the index finger meets one another, that's where the sits bones are. So it's a really good representation of the pelvic floor. You can relax your hands down, but hold this image. Because again, like I said, each part has a different set of muscles, and we can have tension in one group, but not the others, and vice versa. So now take a breath in, everything expands, and as you exhale, contract just the anal sphincter muscle, just the anal sphincter. So that's the easiest one to connect to. And as you inhale, letting it slowly relax as the belly expands. Let's do that one more time. Drawing up. And slowly release. Let's just take a buffer breath. And then we move onward to the vagina. As you inhale again, everything expands. And then as you exhale, can you do just the muscles surrounding the vagina? And then as you inhale, you let that release. So having the memory of the anal sphincter, not that. And after the second time, just take a buffer breath. And now last, inhaling again. And then as you exhale, the urethra at the very top of the triangle. And I know the other two wants to join in, so just be discerning. Slowly release. Sometimes if you go to your physician for pelvic floor issues, they will tell you to practice Kegels, and they will say stopping the flow of urine, which this is all you will be doing. And that is really, we need all of it to work together, not just this. So that is a really terrible cue, just saying. So don't do that. Don't do that. And now let's go back and bring all of them in again. Exhale, contracting all. We're going to do another little exploration where you're going to separate right in half. So just right down the middle of your triangle. Can you contract just the right side as you exhale? Slowly release. Exhale, contract the left side. Slowly release and go back and forth a couple of times and notice, is there a difference in how you are able to control right versus left? There often is. And so that tells us something about our mobility and tension and how that relates to our hip movement and also our sacral joint as these muscles connect to the sacrum as well. So with that information, now on the next in-breath, let's begin to arch the low back. So we're just layering the arch, the contraction of the low back on. We'll exhale back to neutral. Take a breath in. And exhale, flattening. Now draw the pelvic floor up, the whole triangle. And then inhale, slowly release back to neutral. Take a breath out for nothing. And inhale, arch again. Everything expands. Exhaling to neutral. And here you can maintain the awareness and do a little engagement. Breath in for nothing and exhale, flattening. So moving with your breath. Releasing to neutral. Breath out for nothing. Do it one more time. We'll end with the flattening. Just follow your breath. Flattening pelvic floor. And we release. Back to neutral. Now, having the feet about hip width apart, take your hands to your lower hip points, or pelvis points is a better way of saying this, as that's really where we are touching. And then slowly release your right leg out to the side. When you begin to feel a stretch, lift the right knee back up again. And lower down. Feel the release, but once again, it moves into the stretch sensation. Lift the knee up a couple of inches. We're just riding the edge between release, recontracting. So now working specifically with the tension, the tightness that accumulates in the pelvic floor. With the hands on your pelvis point, notice if the pelvis rocks to the side with the knees. I'm just isolating the hip and the pelvis. And then next time you draw up, let's come all the way up. And just breathe in and out just for a couple of times. Notice if your right half of your pelvic floor feels different now as you breathe in and out. Maybe a little bit more spacious. I'm going to do the left side, lowering the left knee down. And up a little bit. So it's not about forcing it down. That will actually create more tightening. So external rotation. As always, I invite you just to close your eyes so you can sense the movements. Is there jumpiness or jitteriness? That gives us a little clue about some tension. So move slower, move less. Allowing the body to release. And then next time you draw up, come all the way up. Walk the feet out a little bit further. We're going for about a 90-degree angle behind the knee. Walk your right foot off the mat, out to the sides. So now will be internal rotation. So my foot is about 6-ish inches off to the side. Flex the ankle. So you're just going to pivot on the heel. Pivot on your right heel. And then release the knee down towards the center of your body, meaning towards the left knee, and inhaling up. Again, keeping your hands on your front pelvis point. So internal rotation. Bringing a little bit more space to the outer hip. Moving up and down. Move as slow, deliberate. Keep a little bit of flattening in your low back. The low back wants to help out by lifting up, and we do that for some of these movements. But again, today we are isolating the outer hip. Do it one more time. And then when you are all the way back up, just toe heel, your foot in. Pause, sense the area around your right hip. And let's toe heel, the left leg out. Flex the ankle. And release the knee down towards the midline and up. Keep a slight, just a teeny little flattening in your low back. Releasing, not stretching. Releasing, not stretching. How does this side feel compared to the other side? Maybe this is the easy side. Maybe it is the not so easy side. So use the information from the easy side. If you notice a big difference, any of these one-sided things we do, I invite you to continue this exploration on your own. Start with the easy side. Always let that tutor the side that's sort of forgotten how to move with ease. And you're just retraining, rehabilitating yourself. It's possible. I know it is possible. Now, next time you lift up, we're going to toe heel, in. And now let's release the knees down and slide the legs long. We'll do it one at a time. Balancing a little bit more, we need to talk to the psoas part of the hip flexor. I'm just thinking, do I want to do this first or second? We'll do the hip flexors first, the main ones. Let's just start by pressing out through the heel and take your hip down with you. So with your hands still on the hip points, you now feel the right heel sliding down, and then just let it come back up. Left heel slides down. Let it come back up. Let's move from side to side. Again, keep it's just a slight flattening in your low back so that there's no overarching. pressing out through the heel, but take the hip down with you. Very much like walking. As you press out through one heel, contract the other side. The other waist contracts. And that facilitates a little bit more jigginess in the hips. Walking without your inner oblique supporting you and your quadratus lumborum, we enlisted those here too, makes for a gnarly walk. So feel the engaging, contracting the side, and just let it release. Gentle effort, no force, no strain. Bring it one more time. On each side. So you'll finish on the left. Now let's press out through both heels. Draw the tailbone down towards the heels. And relax. Relax. Feel the breath. Just compare, think back to when you first lay down. How was the low back? Relationship to the mat. Where are you touching on the sacrum right now? The sacred bone in our body that supports the spine, as it was stated in the poem. Now let's bend up the left knee, bending up the left knee. And then take the hands under the head, take the hands behind the head. So I moved my head blanket out of the way for this one here, as I now have enough support and I've released enough. So for the psoas release, just let your right leg roll out to the side. Don't hold it with the toes pointing up. We'll inhale, we'll start with the arch. And then exhale, flatten the low back, lift the right leg, 3, 4, maybe 5 inches. And as you exhale, keep the low back down as you reach out through the entire leg and slowly, slowly lowering it down. Once the whole leg has come down, we'll let everything cool. Take a deep breath in and out. And let's do that again. Inhale, arch. Exhale, flatten and lift the leg. And as slowly as you can, lower the leg down. Is it jumpy? Is it jittery? One's down. Relax everything. Sliding the right leg up. And slide the left leg up. Inhale, arch again. And exhale, flatten and lift. Lifting again, just somewhere between 4 or 5, 6-ish, but we don't want the upper quads to begin to fire, so we just want to isolate the psoas here. Slowly, slowly, slowly lower down, don't lift the low back. Once down, everything pulls. And one more time, inhale, arch. Exhale, flatten and lift. Reaching out, as there's a button just beyond your big toe that you're trying to get, but press with the big toe mount. So not the tip of the big toe, but the big toe mount. And we connect to the entire inseam. Let everything come down and pull. Slowly release. Releasing. Right leg out, release the hands, and just take a pause. You feel a little flatter across the front groins. Maybe the breath is a little easier in the low back. Sorry, in the low belly. But that would also include the low back. I'm going to slide the legs up again. We'll draw the knees in. So this is the one for the hip flexors where we take the quadriceps into it. So we'll take the legs up. Take the legs up. And then slowly allow the knees, legs to soften down towards the chest. So this is the hip flexors has to help out here. Knees bends. And once down. Now I'm going to count us up to a straight leg again. Count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. I'll count us down with 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And back up again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. One more time down. 1, 2, 3. So melt the hip groins, the front groins. 4, 5, 6, 7, 8, 9, 10. Hug the knees in. And then release one leg at a time. Now slide the legs out long. And then roll over onto your right side. Rolling onto your right side. Bend up your bottom leg, but keep the top leg straight. With the top leg, it's like, okay, it is neutral. I can see it is neutral. Gluteus medius, just a cute little dude right in there. Its main function is to help the thigh bone to be really solid in the socket, but it sort of checks out a little bit. It's a lateral event. So as we're going to just play with it a little bit. So from here, inhale, we're going to lift the leg about a foot, maybe a foot and a half. So it's not a big lift. Take your hand on your outer left glute and feel that it's just a portion of the glute. It's not the whole cast. Now slowly lower the left leg down. Once it's down, let it cool. And we're going to do that again. Inhale, lifting the leg up. Muscle engaging. And then slowly lower the leg down. So we want the muscle to fire, and it is part of our abductor, abductor, taking the leg away from the midline. And letting everything relax. Now lift the heel up, but keep your toes down. So now this way we also elicit the gluteus minimus, the little dude. We inhale, lift the leg up, but keep that internal rotation. This little guy, we need that for walking upstairs to keep the stability around the hip joint. Slowly lower down. Everything pulls. So it's helping the medius, but with the internal rotation, inhale, lifting the heel, and then the whole leg. And then slowly, can you feel you have a little bit more definition on your derriere? Turning the leg down. Releasing down. We'll do that one more time. The heel lifts, and then the leg. And then super slow. Super slow. Down we come. Now take your leg out in front. That's for the IT band. I'm going to slide my left leg up so it supports it. And then from here, we did this one last week. Inhale, lift the leg up about a foot. So the IT band is part of flexion of the hip. So when the leg is straight, it doesn't do a thing, but now it does, doesn't it? Lift the leg and then slowly, I'm going to count it down to 12, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Let everything pull. If this is super intense, you can do it with the bent knee, sometimes called clamshell, but you're not going to get the entire length as it goes down below the knee, but you are going to get this stickier upper part. So bent knee or straight leg for the big Lebowski. We're going to do it one more time. Make sure that you're not collapsing your hip upward, that you're keeping your left hip drawing down away from the shoulder. One more time. Lift 8, 10, maybe 12 inches, and then counting it down again 2. So if you're lifting just with a bent knee, keep the feet together. So keep the feet together. So you lift, yes, lifting the knee. Sorry, I wasn't very clear. Well, we are probably at 8 or 9 or 10, 11, and 12. Bending the knee. And then just slowly find your way onto your back. And straighten the legs out. So we release the glutes on the left side. Can you tell? So we walk around clenching a lot, which again really messes with how we use our legs and spine. I say we do the other side. So bending up your right leg, so you're up on the side. And then lift you bend out your left leg, and you're lifting your right leg up. So first we started this with a straight lift up. So the top leg is straight. And then slowly releasing it down. So this is the gluteus medius, and you again take your hand to your chest, and you'll feel it more towards the outer side of your buns, and not the big guys, the gluteus maximus. We'll get to those here in just a second. We'll inhale, we'll lift again. And then slowly releasing down. And then we add the minimus. So as you lift the heel first, and then lift the leg, so that you an internal rotation, and you recruit it just a little bit more glute. Slowly, 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 lower down. Everything pulls, relaxes. And then when you're ready, lift the heel. You feel the gluteus minimus firing, and then once you lap the leg, we got medius laying on top. It's a beautiful partnership. And we slowly, slowly release down. Toes will come down first, and then the heel. So the legs are out straight from, not out in front, but on one long line. I'm looking at you, Sally. Are you? Yes, take them down. Sorry, I didn't catch that. So down straight for this one, so we get the full length. Yeah. Only for the iliotibia are we doing with the flexion of the hip. So take the heel up first, one more time. Lift the legs. And slowly, 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 coming down. Releasing everything down. Everything pulls. And then here, we can take the leg out in front. So now we have a hip flexion, leg has been out in front. And again, I'll say it again, if you have active bursitis going on, a bent knee may just feel better. And as you engage, you want to keep the feet together, so you're lifting the knee. And we get the upper, we get the attachment, the origins, but we're not getting the below the knee part. But always remember, be kind in this work. Draw the right hip down so you're not collapsing onto the waist. And when you're ready, lifting either whole leg or knee, And then slowly, maybe 12, coming down. A count, but you can go faster. 4, 5, 6, 7, 8, 9, 10, 11, 12. Relax. We're going to do that again. Inhaling, lift the leg or the knee. So about a foot, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Whew. Everything pulls. Now, let's come all the way onto the belly. I said like the glute, because it is time. Make sure that I didn't leave anything undone here. So gluteus maximus, the main job is hip extension, which is moving the leg behind. And it is our main stabilizer when we work. Now let's bring the knees up. Bring the heels up, is what I tried to say. Keep the knees down and slide the legs a little wider. So the knees are slightly wider than the hips. Knees are slightly wider than the hips. Inner heels touching. Big toe mounts touching, so my feet are pressing together. And this is just to give you a little idea of, are they firing the same? I'm gonna have you press your heels together, press the heels in towards one another. And you're gonna get a little glute engaging. Let that go. And we're gonna repeat that again. Press the heels together. Do the feet press evenly into one another? It can be hard to tell. But if one seems a little slack, give it a little bit more awareness. So knees are bent up, feet towards the sky. And then slowly release. Now bring the knees back in together. Now the bottom of the feet are pointing straight up. So now we're going to isolate the glutes. Draw the hips towards the mat. Your forehead can rest on the back of your hands. However is comfortable, turn the head to one side. As you inhale, lift your right knee up. It's not going to go very far. And then slowly release down. So right now we are asking the hamstrings to help out a little bit. But we've taken the hip flexors out of the equation by bending up the knees. Let's draw the hips down again. And then lift the left knee up. Lift the left knee up. Slowly release. I'm going to ask you to observe as you go back to the right side. Does your glute fire before or after the hamstring? So as you begin to lift the knee, what are you feeling first, the hamstring or the glute contraction? I go for the glute contraction. So if the hamstrings are firing first, which is not uncommon, that means the glutes are checking out a little bit. You can take a hand back and check out. As you lift the leg, it should be very firm back there. And then slowly release. Now your hamstrings are helping out, but don't let them be the star of the show. So finishing up on the left side, contract the glute, lift the leg, and lower down. Now straightening the knees out, straightening the knees. Tops of the feet are resting on the floor. And now hamstrings can't really do much here, but I'm asking you to observe the same thing. We're going to lift the right leg up, press the hip down first, and then lift the leg, contract the right glute, contract, 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 and then slowly lower down. Everything pulls. Left side, contract the glute, then the leg begins to lift. Slowly lower down. Let everything pull. Right side again. Glute contract. And you may find that one side is just really lazy. So we are retraining here. Slowly lower down. It is also very common that we have one lazy bun. For whatever reason. Follow your breath. Take a pulling breath in between. Contract the glutes, steady. It contracts the main job, like I said, of the glute. lowering down. We'll finish up on the left side. So we've done an even number. Letting everything cool. Then tuck the toes under. Tucking the toes under. Forehead resting on the back of the hands. And then as you inhale, press the heels back, spike the hips down. And then lift the heart. Draw the belly button up towards the sternum. But keep the legs long, 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 long. And then exhale, slowly release down. Let everything relax. And then let's do that again. Tuck the toes under. Inhale, press the heels back. And then lift the heart. So as you press the heels back, spiking the hips down, lengthening the front. The glutes, are they engaging? They also, yes. And slowly release down. Pausing here. And then slowly find your way onto your back again. Finding your way once more onto your back. Just pause. Legs are long. Sense your low back here. The back of your legs. What has changed since we began? Take the arms out to the sides. We'll bend the knees up again. So we'll add a little bit more. This time, hook your left knee across your right leg. Left leg hooks over the right. Arms are out to the side. Left leg is your ballast. So as you inhale, draw the knees to the left, look to the right. Exhale, back up. Inhaling down. Now we're letting the whole pelvic complex move. It's a variation of the arch and flatten. Inhaling down. That's our arch. And exhale. Back up through the flat. Again, nose moves opposite of the knees. Any twisting movement and where we are cross patterning are so beneficial to release stress that's stuck in the body. So with the eyes closed, allow yourself just to rock in and out. Do it one more time. As we come up to center, pause. Uncross the legs. And we'll switch to the other side. Right leg hooks over the left. And again on the in-breath. Knees dip to the right, gaze go left. Just gently rocking back and forth. No hurry, make it easy. Do it one more time. And once you come up, again, uncross, pause, and then slowly slide the legs long. Let's interlace the fingers. Press the palms towards the sky. That's a good way to bank it all. Inhale. Stretch the arms overhead, tailbone towards the heel. So consolidate. We'll take the arms up. Switch the cross of the fingers. Palms towards the sky. And again, inhaling over the head. And again, take the arms up and let everything relax. Breathing in and out. Let there be a sense of your entire body breathing in. And your entire body breathing out. Gently begin to deepen your breath. Wiggling fingers and toes. Bend out the knees. Rock the knees from side to side. And then rolling all the way over onto one side. And we will push up. Let's come into a comfortable seated. Notice how you're sitting on the ground now. Your hips, your pelvis. Does it feel maybe a little bit more spacious? More grounded? Let's bring our palms together. Closing with one Om, the sound of everything that ever was, is, and will be, to which we belong. Let's take a deep breath in. And exhale, bow your head towards your heart, your true self, that which is not attached to labels or numbers or time. It just is. I'll draw the gaze up. Thank you. Namaste.